Hey, we're sitting here with Jackie and Maria. They are from Norwill. And we're talking about skilled care services that you guys offer. And what can you tell the folks about what is skilled care service? What is skilled care? And then what are the services? And
with skilled care, first of all, Norwill has the personal care side. So this is new for the company, is opening a skilled side. With talking with Maria and Ali, there's such a need for patients with wounds for assistance with skills. There are probably most of the patients within home health have some type of wound or some kind of skin issue that needs to be taken care of, or a respiratory issue. Maria and I go way back. We used to work together. I'm a wound care expert, and Maria is also a wound care expert. And working together over the years, we realized that this was our passion. Also, Maria loves taking care of respiratory trachs, ventilators, anything to do with someone who has a problem with breathing. So, and I have a background also in respiratory, so it kind of goes hand in hand. That these are the patients out there coming out of the hospitals. Sometimes patients are in the hospitals for quite a while because there's no one that really is skilled enough to take care of their wounds at home.
Okay.
So in talking with Maria, we felt that this is going to be one of the best things that we can do. Is it'll decrease the hospitalization, decreases the patient's chances for infection, weight loss, and get them home, get them home to be taken care of. So we do a lot of complex wounds. So it's not just a little cut on the leg. We're talking about big open abdominal wounds, chest wounds, sacral pressure ulcers that are exposing bone. How do you take care of them? So with our expertise, when we go in to take the assessment or do the assessment, we say, okay, this is not the right cushion. We need this type of cushion. We need this type of bed. We need this type of pillow to position them properly. This is the type of nutrition that they're going to need. We educate. That's the biggest thing that we love to do, is educate. Some of my patients in the past, you talk too much, they say to me, no, I'm not talking too much. I'm talking to your loved one. Because it's so important to educate not only the patient themselves, but also the people that are living with them, taking care of them. And it won't, saying it once, okay, but saying it 2 times, 3 times, it's going to sink in. They're going to think of other questions to ask for the best outcome for the patient. And with some of our techniques that we do, the patients heal quicker with more frequent assessment. Direct connection with the doctors. You say, hey, we noticed a little change here. Can we do this or this, or should they come in and see you? So that's going to be the key too, is that direct line to the wound care center, the direct line to the surgeon, so they know there's a change right away. A lot of times dressings every 3 days just don't work. Dressings need to be changed every day, or even twice a day in some instances where they're infected. And that's one of the commitments that we've made, is to be available. If the patient calls and says, hey, my dressing came off, this is what you need to do until we get to your home.
Okay, yeah.
So that whole connection, it's going to help them heal quicker. And my motto, ever since I became a nurse practitioner, wound care expert, all the way through all my education, is get the patient back to living. No more, going out to the wound care center once a week, going out to a surgeon's office once a week, and it goes on and on and on. It could be up to 3 months, 6 months. But with our help and our assistance with being the hands-on or the eyes for the surgeon or for the wound care expert in the wound care center, the patients we think we help the healing that much quicker.
Right. When you have a team that's dealing with you daily versus a person that deals with you once or twice, it makes the healing process better. The more people we can educate that's in your circle, the better it is for your healing.
And I got to tell you, when you mentioned wound care, I was like, okay, there's wrappings and all that, but then you talk about things I would not. Are you sitting in the right thing? Is the right pillow? That's even going beyond. And that's something I wouldn't know, and I wouldn't know that for my loved one. And that's that's comforting, to know that it goes that deep. And
Well, it goes that deep, and not just the equipment, but also how to bathe.
Absolutely.
What types of soaps to use. It's okay to go in the shower and get their wound wet.
yeah.
People don't think, oh, I'm afraid to go into the shower. Water and soap is the best thing for your skin at that point. So they're the kind of education materials that we bring into the home and educate them. The food too. Well, yeah, I'm eating a burger, but it's a McDonald's burger. No, that's not good protein. It's not much burger. It's all bread.
Yeah, right.
So just what do you eat? Talk to them about their intake, and say, okay, well, if you do this a little bit different, then you're gonna have more protein for the wound healing. People don't think of that kind of thing when they're sitting down, to talk to us.
Well, I know the idea of holistic healthcare is kind of a used thing out there, but that's what this sounds like. This is really getting somebody well, and it's an interesting just the fact that they're home again. There's nothing better. That's a huge thing to getting better, isn't it?
Absolutely,
and your family can actually participate, knowingly with having education, give them participate in helping their loved ones get better too.
And I can say definitely for Jackie, it's open and endless. Just constantly. If you have, sometimes I've experienced her having to explain the same thing over and over and over again. However, she does it in a way that it's okay. Oh, this is what I have to do. Oh, I got it. She follows through, and that's the biggest thing. We don't just educate and say, okay, this is what you do. We follow through. Okay, let me see how well you're doing this. Okay, let's see how that's working. And it goes as far as measurements. We make sure that we do the measurements once a week. There's so much that goes into helping a person heal.
Measurements, you're talking the wounds and how they're healing? Okay, that's...
So I think that's a key too, because a lot of places only do a 2-dimensional measurement. We do a 3-dimensional measurement because wounds heal from bottom up and then close over. So if you're only doing the 2, it's only the length and the width. Well, what's really happened with the depth? So people say it's not healing. Well, yes, it is, because your depth is getting less. So educating them, saying there's no change, it looks the same, well, no, it doesn't, because look at the color of the tissue. So we're educating the patient or their families to say, hey, look, this is, and a lot of people ask me to estimate, well, when is she going to be healed, or when's he going to be healed? I said, well, I'm a Benton girl. I lived, I came from the Philadelphia area, but you can't really make a bet on wound healing.
A little different for everybody, right?
Exactly.
Sure.
It really is.
Absolutely.
But as long as you show the positive progress, and that's about the wound description as well as the measurements, and have the families involved. That's one of the things is making sure that they're there to see the measurements, to see the wound care, to see the positive change. It makes it easier in the patient's mind knowing that their family members understand too. So that communication is just so imperative. And having the family at bedside, even if they don't want to look at the wound, even if they're in hearing distance. I have a lot of patients when I was doing clinical work, they would stay in the room but face the wall or look at something different because they didn't want to look at the wound.
Right.
But as long as they were hearing the positive changes that were happening, that's the key.
Yeah, that's really interesting, the positive changes, and just knowing it is healing, knowing that I'm making progress, that's got as much to help the mind and the healing, doesn't it? So,
absolutely.
Hey, if you need some help with this, in this area, these are some great folks who can do it, and it's Norwill, it's healthcare, it's services, and it's even more than that. As you're beginning to know, if you watch enough of these videos, and if you're not on our website right now, visit it, norwillhcs.com, and phone number, in case they want to talk to anybody right now.
216-441-9669.
Hey, guys, thanks so much for sharing that.
Thank you so much.